We want to continue our COVID coverage tonight by showing you what a COVID patient struggling to breathe looks like. This is what happens to people when every weapon in our arsenal is not used to its fullest potential, or even the most obvious one, the vaccine. We warn you, this may be disturbing to some, but it's necessary to see up close just what this nation is fighting, patient by patient. Randy Kay has the story.
You are watching the desperate attempt to save a COVID patient's life. This 75-year-old woman is having serious trouble breathing and is in desperate need of oxygen.
So this patient was being maintained on non-invasive ventilation and unfortunately failed. And so we had to transition to mechanical ventilation, which requires placement of an airway within the endotrachea, within the trachea, the windpipe. So the patient has to be sedated to allow us to access the airway.
Dr. Hudman Ho is a pulmonologist and the medical director of the ICU at St. Anthony's Hospital in St. Petersburg, Florida. As the patient's oxygen levels dropped, doctors quickly prepared to intubate her so they could get her on a ventilator to help her breathe. The process involves a slender surgical probe known as a stylet.
He has a stylet that goes in the tube to maintain some rigidity so he can guide where the tube goes. And he uses a laryngoscope blade to lift the tongue out of the way so he can visualize it. And it's actually a fiber optic visualization. There's a little camera at the end of the laryngoscope blade so he can visualize the airway and guide the tube into place.
It has to be precise, yet time is of the essence. Lives are on the line.
Got it. Intubating. She's coming back up. Wow, her heart rate stayed rock solid there.
For this patient, a second chance. Later, we learned she had received her first dose of the vaccine, but got COVID while waiting for her second shot. Still, most patients here are unvaccinated. Across the Baycare hospital system, which includes St. Anthony's, hospitalizations have increased tenfold since the beginning of July, and about 85% of the ICU patients are unvaccinated.
Do they express regret that they're not vaccinated?
We have had patients that come and request, can I get a vaccine now? But they don't understand that it's something that's meant to be preventative, and once you have the disease, it's not helpful.
Dr. Warren Abel, a critical care physician in the ICU, calls the pandemic, quote, our World War II. Unvaccinated patients as young as 20 years old dying before his eyes.
Every person that passes away that was unvaccinated, it's a preventable death. It's heartbreaking, actually.
27 of the 28 ICU beds here are filled with COVID patients.
Good morning.
And far too many are on ventilators, like this woman.
Can you nod your head for me? There you are. All right, good.
Almost always before they get intubated, they want to call their loved ones to tell them they love them and say goodbye. And unfortunately, oftentimes that's the last time they speak to them.
For people who say, this is Florida, we're past it in Florida, we're good, what do you say to that?
This is one of the worst waves that I've experienced. I mean, I think things are as bad with COVID as they've ever been in Florida.
No, come spend a day with me. You'll see we're not okay. I walk down the hall and almost all of our patients are on their bellies to help them breathe.
And Randy Kay joins us now. Randy, given the surge in patients, given that we're not okay, as these healthcare workers are saying, does this hospital have what it needs? Does it have enough ventilators?
Well, John, they have dipped into their hurricane supply of ventilators. Those are the ventilators that they would have put aside for a major storm. So they are using those. They're also using these refrigerated mobile units as morgues. So they need those as well. And funeral homes also, John, in this area are feeling the impact. We spoke to the funeral director at Wilson Funeral Home here in Tampa. And he told me that not only has he buried friends of his, but he's also running out of caskets. He's now ordering multiple caskets a day. He's had to move the hearses out of the garage to make room for more caskets inside that funeral home. And he also told me he's having trouble scheduling funerals because the cemeteries are so busy. He can't even get a funeral scheduled on the books. So I will just tell you that being in that ICU, for anyone who thinks that, that we shouldn't be wearing masks or we might not need to get a vaccine, they should spend a day with those healthcare workers, walking in that ICU, walking in their shoes. They could change a mind, John.
Yeah, indeed. And a bull market for funerals. What a tragedy that is. Randy Kay, thank you so much.